Good morning, everybody, and welcome to the Martin House Research Centre conference. I'm Lorna Fraser, I'm the Director of the Martin House Research Centre, and I'm delighted to be able to welcome you to our second biannual conference. I'm really disappointed, however, not to be able to welcome you to our beautiful East Campus in York, but I'm hoping that the virtual format will actually enable some of you who maybe couldn't come and spend a whole day in York to be able to join us even for part of the day. And certainly we've had more than 250 registrations for this conference, which is excellent, and a really good mix of clinicians, researchers, parents and other service providers. So I do hope that you enjoy our day. Just a couple of housekeeping things. We will, as said on the holding side, we will be live recording, and the recording will be available on the Martin House Research Centre website as of next week. Attendees, if you want to ask questions, please, which we encourage you to do, and some of the amazing presentations later on, please use the question and answer function to ask questions, and they will be picked up by the chair and answered by the panelists. Now, it's not a small task organising a fully virtual conference, and I really want at this point to thank Michelle, our Centre Administrator, and Steve, our AV assistant, for all the help that they have given to myself and the rest of the team and the participants. If you do have any issues during the day, Michelle is available on that phone number or email address. And I know some of you tweet, so please do tweet using the hashtag MHRCConf21. And if you don't already follow the Martin House Research Centre Twitter feed, I would encourage you to do that. Bob, I hope you're on this one already. So we have a great programme this morning. We have three really good plenaries, as well as some short and rapid fire reports from the centre team and from the submitted abstracts. Now, some of you hopefully will have had an opportunity to look at the longer pre-recorded presentations before this session, but if not, again, they'll be available afterwards. So if you really want to know more about some of the topics that you hear during these sessions, I would encourage you to do so. I would also really like to highlight the session at 1:30 where Joe Taylor, the PPI lead for the centre, is going to facilitate a session with our parents from the Family Advisory Board. So just a couple of words about the Martin House Centre. For those of you that don't know, the Martin House Research Centre's vision is it will be a resource via model of collaboration with families, professionals and academics and other institutions that undertakes and enables high quality applied research of national and international significance. This isn't about research that sits in academic journals, it's about research that makes a real difference and a change for children and their families. So we have made some progress towards that vision. We're nowhere near there, but we have made some progress. We've had 30, we're in the 5th year of the Martin House Research Centre now. We've got 30 research studies, 10 of which are complete. Some of both the process actually and the outputs of these studies have been informing commissioning, both locally and nationally. Our work on the numbers and prevalence of children with life-limiting and life-threatening conditions, alongside our evaluation of the managed clinical network for children's palliative care in our region. Some of our studies, including the YouTube study of blended diets in children with gastrostomy feeds and the early days study of the early days of bereavement, of parents' experiences of bereavement, will be informing national and international guidelines. Capacity building is a key aim of the centre, and we have 4 PhD students. Our first PhD student, Mary Barker, has submitted and actually has her Viva in a month's time. So good luck, Mary. We know you will do very well on that. We have also been working closely with clinicians and practitioners to help them get involved in research where they wish to. That little beast on the right-hand side, COVID obviously has had an impact very much on the children and families that were interested in the research helping, but also on the team themselves. People have had to change working patterns, have had to juggle childcare, homeschooling, etc. But there has also been a silver lining to COVID. We're going to hear an excellent presentation from Susie Lapwood later about the speed at which research can happen if we have a pandemic and a crisis. It's given me the opportunity to work with the grown-up academics in adult palliative care, in the COVE-PAL study, which is led by Professor Irene Higginson from Cicely Saunders Institute, looking at the role of palliative care services, including children's services during the pandemic. And my colleague Jo Taylor has been able to lead a piece of work called the SHARE study, looking at parental experiences during the pandemic. Now, all of these require collaboration and working really closely with families, clinical staff, service providers, commissioners, etc. And they really are key to us being able to successfully complete and implement these research studies. Now, if you want more information, the Martin House Research Centre team are presenting on 6 of our studies at 10:10 this morning. But if you want any information about the remaining studies, they are all available on our website. And just as a final thought, I really want to take this opportunity to thank both Martin House and the University of York for their support in funding the Research Centre. If it was not for this core funding and support, we would not have been able to undertake certainly the volume and quality of research that we've been able to do. But that has taken absolutely is teamwork. You always like it when your Garmin goes off saying an abnormally high heart rate in the middle of a presentation. Unfortunately, I'm not in a room with any medics. I'm sure I'm fine. But teamwork is so important, and we are really lucky to have an excellent team. I have senior support from Bryony Beresford, from Sue Picton and Lucy Ziegler on our management team, but we also have a team of 12 or 13 research fellows, PhD students and support staff who all work together amazingly well and contribute to the work of the centre. We have been lucky in getting external funding from these other organisations on the bottom right hand side there, so again an opportunity to thank them for funding our work. But the most important thanks really goes to the children, families, clinicians and services that we've worked with over the last 5 years, because without them, we wouldn't be able to do the work that we do. So thank you very much for joining us today, and I really hope you have enjoy the sessions. You're going to hear a bit more from me in about the day, but at the moment I'm just going to hand over to Dr. Anne-Marie Childs, who is a consultant paediatric neurologist at Leeds Children's Hospital, but is also a medical trustee at Martin House. And Anne-Marie is going to talk to us about the value of the research centre to Martin House. So thank you, Anne-Marie.
Thanks, Lorna. Thank you very much for asking me to give some remarks at the opening of the conference. And I guess the reason that I've been asked is because of the Venn diagram that Lorna's just shown you of all the different people and services involved in the research centre. I probably stand at one of the kind of more busy intersections of the Venn diagram, which my children tell me means I'm an intersectional person. I'm getting with the lingo now. But Lorna's talked about the achievements of the Martin House Research Centre, but I really wanted to start by just saying how impressed I am really with the success of the centre, and I think with the vision of the people who had the concept in the first place and brought it to fruition. And that would be the board of Martin House. I can take no credit for that because I wasn't a member of the board at that time. The University of York and Lorna and her colleagues who saw the opportunity of bringing a group of people together to really help move things forward in the area of palliative care research. And the achievements are there on that slide. And Lorna's talked about the 30 studies across the 6 topic areas. But the fact that they've managed to gain £3.5 million in funding is really, really impressive. I think I've achieved something like 8,000 in my entire medical career to date. But most importantly, as Lorna said, the fact that so many people and so many important stakeholders, particularly families, children and the staff at the hospice, have been involved in shaping the way the research has been developed and delivered is really critical. And the capacity to bring together all these different research sites in trying to answer really important questions in the area of palliative care medicine, together with all the other PPI members and agencies is very impressive. and not surprisingly has resulted in 30 peer-reviewed publications. But as well as singing their praises, I just wanted to think about and highlight why the success of the centre is so important to Martin House. And I hope most of you are familiar with Martin House, but you may not have seen the strategic plan, which I'm not expecting you to take in on this slide, but just to highlight the core objectives of Martin House. And my slide making skills are still not great, sorry. But I hope you can see that there are 4 core objectives here to ensure that the service is provided of the highest quality, safety and effectiveness, that the house has the right resources to deliver the care, is able to meet the diverse needs of children, young people, families and their supporters, and to raise awareness and to reach more people in order to deliver the vision, which is that every child and young person has access to palliative care when and where they need it. And you'll know that in order to do that, in order to ensure that you are delivering the best possible service with the right resources, it's really essential that you are underpinning your services and decision making with the best possible evidence. And the best possible evidence in palliative care is not quite the same as the best possible evidence in deciding what treatment you're going to have for ischemic heart disease. For lots of reasons, it's very difficult to answer the questions. And that was one of the reasons it was so important to develop the centre, to be able to get the right information and provide the right evidence to effectively know that those of us in Martin House are fulfilling the elements of that strategic plan. And I think that it's been really important to facilitate parents, families and carers in finding the answers to important relevant questions. And certainly those of us in clinical practice don't always appreciate what they are. They don't always appreciate what the critical issues are for families and parents. I think sometimes we think we know best, and we don't always, and it's really important to listen. But the centre's been able to engage the wider clinical networks and resources so that we can make the appropriately structured studies to answer the key questions. And that has both an internal and an external facing role, which is of benefit to Martin House, and on that 4th aspect of raising awareness and engaging wider networks. And I think is beginning now to translate those findings into real benefits for the service and for families. So I hope that when moving forward, the centre will be able to build on the initial vision that people had 5 years ago, to be able to maintain the quality of the work they're doing and the success of their output. And obviously that will require continued engagement of key stakeholders and some of those other services that Lorna highlighted, involving NHS England and NIHR, in understanding what's important in palliative care so that we can translate the findings into the wider community. And I think that, you know, Lorna and Bryony and the team have developed a really excellent core of research workers and administrative support, and they've already developed their knowledge and skills, and it would be fantastic to see them consolidating that and moving forward in a secure way. And these are difficult times, obviously, the difficult times for everybody with this lovely pandemic, but particularly for charitable organisations where many of the traditional fundraising activities have been curtailed by the pandemic. So I think it's really important that we think really carefully about how we focus our resources and move forward successfully in the future. And as I said before, I really want to see us translating some of the outputs into real benefits for children, both within Martin House and the Yorkshire Palliative Care Network, but also in the wider community. One of the first occasions I had to work with Lorna and with the team at Martin House, as it was then, was when we were contacted by Johns Hopkins University, who were wanting to do some work looking at palliative care in the context of neuromuscular disorders. And Martin House had stood out as a place that was an exemplar of good clinical practice. And I was really impressed by that. And I think that the work that the centre is doing is going to mean that we've got another few stories on the skyscraper and that will be a beacon, hopefully, of good practice and good clinical care, not just in the UK, but in the wider world. So good luck and thank you very much. And I'm sure you'll enjoy the presentations today.
Thank you very much, Anne-Marie. It's so good to hear from from both the clinical and from Martin House side of the importance of our work, but also of the key role of the children and the families. And that has been something that has been central to the research centre since the start. And I said earlier, we've got a session at 1:30 where we're going to have an opportunity to hear from some of our parent advisors. But we also now are going to be able to, I'm really pleased to be able to share a video from one of our young adults involved in the centre, Naveed. Now, Naveed has prepared this video himself. This isn't the work of our AV technicians, and I find it very, very powerful. And I know that Naveed may not be able to join us this morning, but I know his mum and dad, Mo and Naheed, will be watching on very proudly.
Hello, my name is Naveed. I'm 24 years old and I have a string of health issues which I cope with every hour, every day of each week. My bones, my heart, my lungs, my kidneys are all not well, but I get up each day to a new day because life's too short. My complex health life comes with a complex daily medication routine. I thought I was alone here, but joining in conversations with a group of young adults made me realize I wasn't. At Martin House Research Center, they have a research group for young adults. It was here that I learned that taking so many different medications for my different health issues was called polypharmacy. I have really enjoyed the group work here and loved being part of a group where I can learn and share my own thoughts safely.
Why research is important to me?
To improve and better my health as much as we can through medical and health research. With strict guidelines to set up organizations and bodies that can carefully and safely administer trial drugs to humans. To find out how other people with similar health issues as mine will tolerate and cope with different drugs to find any different outcomes to mine. To have written and actual used experiences from a wide variety of health users to better a product. Health research is vital for all of us today and for all of the tomorrow.
Why you think patient and public involvement is important?
It's simple because we are the patients that are going to use the drugs, machines, or have their procedures carried out on us. It's going to be for us. It's going to affect us. So it just makes sense that we should be asked and should have a say in things. We should let people know if things work out right or not. I know I can speak and will be listened to with respect, dignity, and with the utmost confidentiality.
Well, that was just a really powerful video. Mo and Naheed, please do pass on our thanks to Naveed for sharing that with us, and I hope he might be able to join the conference later on. But we will be hearing from Naveed's dad, Mo, during the session after lunch. So excellent. So that's the end of the welcome session. So thank you very much, Anne-Marie, for your session and input. And we're going to move on now to our first plenary session of the day.